I started residency and had a large number of refugee patients in my continuity practice, I really struggled specifically with mental health. Being interested in research, one of the ways that I sort of respond to the feeling of not knowing how to do something is to go out there and talk to other people who are comfortable with it. So I partnered with the Philadelphia Refugee Mental Health Collaborative to conduct a provider mental health needs assessment. You know, what could a mental health collaborative composed of people from all types of disciplines working with refugees, what could that collaborative do to improve provider comfort with working around mental health and refugees? The first main area identified by provider interviews was communication. So communication on many different levels. How do you communicate across a language barrier with refugees about mental health? And then how are providers communicating about mental health? Are psychiatrists and mental health specialists, are they talking to the primary doctors? And what is the best way to sort of integrate physical and mental health with refugee populations?
I think that personal connection is so valuable, to know about the culture. I think to even be able to use a few words of greeting or hello in their own language really can help to connect. To introduce yourself and your role is always really valuable. People can be very confused about all the people they've seen that day, the different services being provided to them by different people, and to give them that kind of introduction can be really valuable.
Whenever I start talking to a patient and I'm identifying myself as a psychiatrist, I like to explain that, well, first I like to check and see if they know what a psychiatrist is, right? A lot of patients actually do know what psychiatrists are. They've seen psychiatrists in their home country. They're familiar with the concept. If somebody isn't, I like to explain to them that I'm a brain doctor and that I also deal with emotions. So a brain and heart doctor, I like to describe myself as.
It's great to open the discussion in a way that allows patients the opportunity to take the whole conversation at their own pace. So being able to ask open-ended questions that solicit the information that you might need for whatever process that you're embarking on, be that a medical screening or information needed for a referral, but being able to ask questions in an open-ended manner that clients can say yes or no to, if that is the level of comfort that they have at that time, or being able to provide more detail.
I think that one of the hardest things to do when I'm doing specific psychiatric diagnosis is translating my DSM terminology into words that make sense for interpretation and words that make sense for a patient and their life. And so it's always a good starting point to say, what do you call this where you're from? Do you have words for this where you're from?
Sometimes interpreters aren't great. So, I think using pictures, using body language, using hand language, we do a lot of parents' presentations and parents' meetings and small groups, and I think that's really helpful training for med students, because it's, if you can teach a Bhutanese patient who doesn't speak very much English about hypertension, your chances are pretty good that you can teach an English-speaking patient about hypertension, because you boiled it down to these really, hopefully simplified, versions of these really complicated concepts. So I think that's an important skill to have working with these patients.
I just tell them, ask one question, different way, make them to understand, make them to feel better. And my community need to know, like most of my people have a high cholesterol and thyroid. But doctor said you have a thyroid. But they don't know what is mean by thyroid. What makes the thyroid problem? What makes like a high cholesterol? They don't know. They are asking me, most of the people they are asking me, Vishnu, what is mean by thyroid? And how can I explain them? And I just give suggest to the doctor. Please explain them what is mean by thyroid and what is mean by like a cholesterol.
The phone is difficult. What they said is it may be my ear he heard different words. What he says, it cannot be clear to me sometimes.
The first step is usually just making yourself comfortable with interpretation. It's not scary. If you're using phone interpretation, I like to have the phone on speaker and have it loud as possible. And I like to set up the room so that I'm looking directly at the patient, and I try to do my best without being too forceful to let them know I'm making eye contact with them when I'm asking my questions. You should be making eye contact with me when you answer my questions. So you're doing your nonverbal cues to try to let the patient feel comfortable that I'm talking to you. I'm not talking to the person who's on the speakerphone. I'm talking to you.
I think it's really important to maintain eye contact with the patient when you're using a phone interpreter, not look at the phone, to speak really clearly into the phone so the interpreter can hear you, to be aware of your kind of body language and your nonverbals, to not maybe respond immediately to something that the interpreter says because it's going to be off. There's going to be a little time lapse between what the patient says and what the interpreter says. So there are a lot of small skills there that are really important to consider.
There are so many barriers to obtaining mental health services for refugee patients. First and foremost is knowing where to refer them to. We are lucky that in our department we have a social worker that is with us at the visits, and when we come out and tell her that we have a patient that needs mental health services, she's able to get them plugged into different locations throughout the city. The toughest part of that is we don't receive any feedback about the mental health services that they received. And I can only imagine having frequent trips that they need to make to see the mental health specialist would be difficult for them navigating the transportation system. I also think the visits with the therapists themselves would be very difficult. Having an interpreter there, I'm not sure that they would get the most out of an hour visit if everything has to be translated. And I'm sure much of that and much of their feelings would be lost in translation as well.
When you're referring to external resources, I think it's always important to consider the language that you're using and the way that you're framing that referral. To not frame it in a way that means that they need extra help or that there's some kind of deficiency that needs to be filled, but that it's just an extra support that might be in place or something else that might be available to them, to kind of encourage them to have some connection with the community. I think we have a lot of great arts programs and ESL programs and things like that that can be seen as supplemental, not necessarily as you have this deficiency and we need to fix it, but as an extra layer of support or contact with our community. It's also really valuable to have connections at the various services that you're referring to. It's a completely different picture to say, I'm going to refer you to this shelter and here's the phone number, than to say, I'm going to refer you to Joe down at the shelter. I know him really well. He's a great provider and he's helped so many people in the past. Let's go together and have a conversation with him about the services they can offer.
Looking back on my training as a doctor, I think it would have been really valuable to have a resource like this video to provide some tangible, practical, easy skills that would give me more comfort in approaching mental health with refugee patients and essentially make me a better doctor.